what do you think are the sort of top 2 or 3 things that are really sitting behind the need for reform of primary care?
So Leanne, people have been talking about the need for reform of primary care a long time, and there's been lots of talk. And so you think, why has there been that talk? Well, first of all, when Medicare was introduced back in '84 and Medibank previously, the conditions that people had were much less, way lower prevalence of chronic disease. And so I've got to say, well, the world has changed over the last 30 years. Have our funding arrangements, governance arrangements, systems, is it right now for the patients we're seeing, for the needs of the population now? And the short answer is probably not. No. You know, so you need more allied health people to be involved. You need more podiatrists and all of that, mental health psychologists and so on. The other thing is, we've got to think about primary care as part of to become much more preventively oriented.
Yes.
To be more proactive. And with a system which is principally fee-for-service, it's reactive. People come to the GP, they see the GP, they get a bill. But we want to be able to reach out and say, you know, how are you going? You might need to come in. And in a fee-for-service system, that's seen as very bad, generating demand and so on. So, you know, we've got to step back and say, what should the system look like in 2024, 40 years after 1984, when Medicare came about?
So if you were able to describe the general practice of the future, what would that look like?
So if I start, the general practice of the past was very often single GP, entirely fee-for-service, generally not other people in the team. The general practice of the future will be more than one GP, nurses doing functioning autonomously within the general practice, allied health people, funded partly fee-for-service, it will remain, but other funding streams and so on. Also networked in. So participating in quality improvement activities, participating, you know, so being much more part of a whole system rather than a freestanding small business. But Leanne, it's also about skilling up.
Yes.
You know, you want to have access to a range of services, you want to be able to do more, have more interesting work you're doing, and so on. So, you know, how can I do my work better? You've got to be part of a quality improvement.
Yes, and also we know clinician satisfaction comes from working at the top of scope.
Yep.
And being able to work with peers and colleagues and other disciplines.
Yep.
So one other question, what are the 2 or 3 things, maybe more, that we need to start doing now or would like to start doing now that could be foundations for the future?
The general practice has to have a population focus, and there's a bit of that now already. I mean, you know, what proportion of your patients have had fully immunised and all those sorts of things. But we want to go a bit further than that and actually say, do you have a diabetes register to call people in and blah, blah, blah. So we've got to actually start to think about the general practice looking after a population, in which case we've got to say people have to enrol with that and say, I want to be part of that population with that practice. And the practice has to say, I want to be part of this new way of doing things. And not every practice might want to, not every patient might not want, but you've got to start somewhere. So I think what's most important is thinking about what the foundational elements are. And there's been a whole lot written about this. There's these 10 foundational elements of good primary care, one of which is having a population base. Now, then you say, well, who cares? I mean, this is just for nerds. And now you say, well, once you've got that, you can have a nurse employed in the general practice who rings out and is proactive and all those sorts of things. So you've got to get the foundations right. which might not be appealing to very many people, but you've got to then say, well, we've got to do the foundations and we've got to do these other things at the same time.
You know, we are in an environment where the Strengthening Medicare Task Force is but one of these vehicles now underway to see what we can do to start to...
And you've got 10% of that task force sitting here in this room.
Stephen and I, thank you very much. Bye for now.